Hello, in this video, I'm going to be talking about the top 3 mistakes that people make going through breast cancer treatment. Before I go on, I want to invite you to subscribe to this channel and also to go to Yerbba.com to get your personalized report. Your Yerbba report takes your medical records after you give us permission and creates for you a report of everything that's been done, all the results, and interprets that for you. It also cross-references what we know about your tumor with the latest medical evidence. It's updated so that it's not just a static one-time report, rather it's dynamic. And it will show you treatment options that you might hear about when you go to the medical team that's taking care of you, when you see all those doctors, and the pros and cons of those options. So go to Yerbba.com to get your personalized report. So I hope I've made you interested. What are the top 3 mistakes that people make? The first one is not reporting their symptoms or ignoring symptoms until they get really, really bad. What I have seen and heard about from colleagues is that patients wait. They want to be a so-called good patient. So they wait to make note of their symptoms before reaching out for help. There's this pressure on people to be a non-complainer, to be a good patient. They're worried if they report their symptoms accurately that their medical team won't like them. If this doesn't apply to you, good for you, but there are more people who worry about bothering their doctors, being seen as a complainer, being a whiner, etc. You're not. I actually reframe it as you're being a reporter. You're reporting your symptoms. And what is really helpful is to tell your medical team the impact of your side effect on your life. So instead of saying, it's really bad, say, I'm not sleeping well. I haven't been able to enjoy time with my family. Paint a picture for your medical team, whether it's the assistant on the phone or the physician or nurse practitioner or physician's associate in the office. Paint a picture of how this symptom is affecting your life, and don't wait till you see them again. Just let them know what's going on. They can give you an intervention and see how that's working when you see them again, and make more changes in how they're managing side effects or in the medications themselves. Don't wait till you're worn down. Speak up early and accurately and clearly, and don't worry that your team is going to judge you. They're actually really grateful when you report your symptoms. The second mistake people make is overexerting themselves, or on the other end, closing themselves off too much. So overexertion happens when we're trying to maintain our normal life. Look, breast cancer takes away your normal life, at least for a while, right? So you were already busy. You did not need to be diagnosed with breast cancer to feel you had a lot on your plate. You're a partner perhaps, or maybe you have children, or maybe you're taking care of a sibling or your parents. You might have a job where you, guess what, take care of other people, or you work for somebody who needs you to take care of them. You're already very busy, and then in comes breast cancer as this big, let's call it an elephant in the room. If you try to maintain things as if nothing is happening, it's very likely that you're going to be worn down and that your recovery is going to take longer, that it's going to take longer for you to heal, and not to scare you, but your immune system gets really beaten down if you're not making time for yourself. The other mistake at the other end is not doing enough. It's not getting outside. It's not tending to movement, not tending to your body, not reaching out for support. So those are the 2 extremes. The one that I'm really speaking to today is the overexertion, but equally important is to avoid spending the entire time in a cocoon. I really believe in cocooning when you need it, in those few days after chemotherapy, or before you get ready to get your next treatment, or at the end of radiation therapy. But we want to make sure you don't get isolated or frozen in time. The third mistake people make is neglecting your emotional and mental health. If you are not somebody who, what I hear is, I'm not touchy-feely. I never hear people say, I am touchy-feely. But people, if you view yourself as somebody who doesn't delve into your emotions or your mental health, this might be a time to crack that open and try something new. Check out our videos on what it's like to be ghosted, dealing with anxiety or depression, or many of the others. You can just search on this channel for all kinds of things, forgiveness and dignity and, you know, trust, all those other things. If we don't give words to those, they actually can be like an untended wound. And we know that untended wounds don't just go away. They end up flaring up, if not now, at some point in your life. Reaching out for support, telling people that maybe you care for, and, you know, people whose care you're 100% responsible. Look, I need to take care of myself for a little bit. I will be here for you, but right now I need to tend to my emotional needs. It's really setting up some boundaries, and of course we have a video on boundaries. I've covered a lot. I hope this has been helpful. If you have other thoughts or questions or reactions to this video, you can put that in the comments or questions below. What I would do is invite you to be kind and examine any anger you have that could be untended trauma, and take care of yourself and take care of each other in this Yerbba community. Thank you as always for watching, and we'll see you next time.